Ark-La-Tex Gazette, you guys, today with nurse practitioner Jashandria Bell. And you're with Beautiful Minds, am I correct?
Right, it's a Beautiful Mind Consultant.
Beautiful Mind Consultant. I met Jashandria, you guys, a couple of months ago when we first started the Gazette, and at the time we were just doing the writing. And when we found Jashandria, the reason why I called you back is because you were so wonderful.
Oh, thank you.
And people nowadays, they're just not reading like they used to.
Yeah.
Okay. So we moved over to the podcast because this is what people are doing.
Yeah, we gotta come up with what everybody's doing.
Yes.
Yeah.
So I'd just like you to tell the community who you are.
Okay.
Because I just found you to be just a wonderful, beautiful being.
Oh, thank you so much. Thank you so much. So as she said, I'm Jashandria Bell. I am a mental health nurse practitioner as well as a family nurse practitioner, but I work solely with mental health now. I own It's a Beautiful Mind Consultants that's right here on Ninth Street. And I pretty much service the community from the children to geriatrics dealing with mental illness, dealing from, ADHD to psychosis, bipolar, depression, everything in between.
Right.
So my private practice, I actually see clients in person as well as some telehealth. I service the whole state of Louisiana because my license covers the whole state of Louisiana. So I have clients as far as New Orleans, just everywhere.
And Ms. Bell, what I find is, and I meet with a lot of mental health professionals, I do. I would like for you to tell the city what's the difference. You see, you have your social workers, you have your professional counselors, you have your clinical social worker, and then you have your nurse practitioner. And I think, even I do it, I may get you guys confused on your expertise. I'm not sure if it's all one lump sum.
Okay.
Explain it to me so that I can.
So everybody have their own individual discipline. So everything that you just named is totally, they have different disciplines that all serve under the umbrella of mental illness. And so as a nurse practitioner, what we do is we go in and we provide medication management for mental illnesses or medical or whatever entity that they have a specialty in. So as a mental health nurse practitioner, we're providing medication management. That is what kind of separates us from everything else that you just named. A lot of the other entities that you've named do a lot of therapy, a lot of counseling. And so the way it's set up is that my medication, along with what the social worker and the therapist is going to bring in, together we are the perfect pair. So it's like a lot of times I tell people all the time when they're on medicines for different things, you want to get to the root of why we're on this medicine or what's actually happening. In order to get to the root, I need my clinical social workers. I need my LPCs. I need my therapists. I need those people to come in and bring in that therapy aspect to help that person do the work and dissect what's going on in their past, what has happened to get them to this point. And as they're doing the work and unraveling what's actually going on and what was the root cause of it, it allows the medicine to come in and work a whole lot better. Without therapy, I always see medicine as like a Band-Aid on an open sore. You gotta have both.
Gotta have both. What are you seeing today? I know we talked about it earlier, and I talked about all you social workers, everybody mental health, not your social worker, but they're telling everybody is kind of saying the same thing about the community, what we're seeing in the community when it comes to mental health. I spoke with Elena last week, a nurse practitioner, Elena. And she was talking about the homeless population, etc. What are you seeing as a nurse practitioner in this community?
Wow. So in this community, what I'm seeing a lot of is I have two main things that's kind of near and dear to me. One is the addiction. I'm seeing a lot of addiction in our community, and not just addiction from street drugs is what we identify, not just meth and opioids and different things like that, but I'm also seeing a lot of addictions of benzodiazepines, and that is like your Xanax and your clonazepams and lorazepams, those types of medicines. I'm seeing a lot of addiction from that, but the addiction has been kind of masked or covered by my doctor gave me this, right? Yeah. And so when you go back and I get new clients that come in that are on these medicines and I do an evaluation, why are you taking these benzos? Why are you taking this medicine? And how long you've been taking it? They'll tell me, my mom died 7 years ago and I've been on it ever since. Well, as hard as death is, we don't like death, but death is a part of life, right? So we got to learn how to cope and deal with life skills. So if we're dealing with life skills, these are not the types of medicines that a person should be on for years and years at a time, because we're creating a codependency upon the medicine. And that is not what it's intended for. These medicines, a lot of them are short-acting medications. And then you look at the DEA and different guidelines that we are governed by, it'll tell you no longer than 14 days at a time, different things like that. When you see somebody, oh, I'm taking Clonopin 3 times a day for the last 20 years, and then you come to someone like me to say, hey, we don't support that. We need to figure out a way. So I want to put you in therapy. I want to figure out where this anxiety is coming from, what is going on. Let's get to the root of that. Then I get resistance from that, because it's like, well, I'm doing what they're telling me to do. Unfortunately, that provider or whoever put you on this medicine, I don't think they intended you to be on it for 20 years, There's somewhere along the lines, the ball got dropped. A lot of times it can be a patient hopping from one provider to the next. That happens a lot of times. And then sometimes you have some providers that's just what they do. I'm not one of those providers that support that. Everybody needs medicine, but at some state, but it's not to the point where I feel like you should be codependent upon it. So that's one of the main things that I feel like I'm running into, is that resistance when you come to the addiction, when it's connected to a prescription drug. And so that's very hard to navigate. The other main thing that I'm running into is dealing with our children. When I started this, kids has never been my thing. That's not my niche, right? But I am trained as a mental health nurse practitioner, family nurse practitioner, to take care across the lifespan. So when they walk in the office, I'm going to do what I need to do. And what I'm finding is that we have a lot of our children that are suffering from a lot of behavior issues, but they're also suffering from a lot of mental health issues that is connected to psychosis. That is connected to like the hallucinations, hearing voices, seeing things, being paranoid. Some of them may even be drug induced, because we see our children using more and more marijuana and different things that may be laced with other things that's causing them to go into a mental breakdown. But also we're running into, there's a lot of genetic factors that falls into this category. So these children that are presenting with these psychological issues at a much earlier age than what medication would allow me to treat. So, a lot of my kids that are suffering, 15, 16 years old with these, with the psychosis, with schizophrenia, with different things like that, it is hard to treat them, because in my mind, I know they need an injectable. I know they need a particular medicine, but I can't give it to them until they're 18. So when you can't give them these particular medicines until they're 18 years old, now we got to try to navigate to figure out. So now we're treating symptoms. We're trying to, okay, take this pill to help with this and take this pill to help with that. And then, or you might have a child that may be suffering with something, and they've been on Adderall, they've been on all these ADHD medicines, but I can pick up and say, I see the characteristics of ADHD, but the root of this is really manic bipolar, or it's really this with some psychotic features because of, whatever the parent is presenting to me, or what I'm actually seeing in the child sitting right there in front of me. But my hands are tied on the medicine that I can give because of age. So that's a hindrance as a provider. And I know I'm not the only one that's facing that, but that's a hindrance for us as providers to try to provide a effective treatment plan. So again, we rely on our therapists. We rely on those counselors and those social workers to say, hey, help me out with this. Let's try to put this kid in some therapy. Let's try to help do some behavior modifications. Let's get the family in to do family therapy. Because I go to different behavioral health agencies here in the city, and I would send clients there to say, hey, this kid needs more than what I can offer. I'm going to do the medicine on my end. But when I find myself in situations like that, that's when I really, really, really need that connection in order to, come up with a better treatment plan. So that's when those counselors, those social workers and LPCs are jewels to the treatment plan.
Right. Just a question, and this is just a question that I had. When you're seeing these kids, you said that are not 18 years old with these problems, psychosis, you said hallucinations and all these things. I do dabble in that industry as well, but on the human service side, not the mental health side. And I see a lot of times those kids start very early. The parents, maybe at the time of conception, may have been substance abusers. Does that have anything to do with what we're seeing today as far as a lot of those kids having those issues? Do you think that could be a contributing factor?
I definitely think it's a contributing factor. I don't have all the research behind it to throw numbers out
Right.
and see if this blind study was done, but definitely you see a lot of differences in their behaviors. You see a lot of differences in how these children even learn in school, so it's a lot of things that's impactful, as well as you have to understand that if you have a parent that has mental illness, and you're born of that's a genetics. A lot of
Right.
things are genetically connected, and unfortunately, our kids are being, exposed to a lot of things sooner. Whether it's drugs, whether it's abuse, and people have to understand this too. Is that whenever I do an assessment, that's a question that I ask is about genetic factors, and a question that I ask about the home environment, about abuse, physical, emotional, psychological, sexual, and a lot of times in our culture we shun away from that. We shun away, especially from sexual abuse, or we'll say, well, it wasn't abusive in my house. So I wasn't exposed to anything traumatic. My parents just fussed and cussed all the time.
Right.
That's traumatic. That's a traumatic experience. You have been exposed to a lot of yelling, screaming, hollering. So what does that do for a young kid? That makes them nervous.
Yes,
that makes them on edge. That makes them insecure about who they are, because they don't know what to do, when to do it, how to do it, because they don't know how the parent is going to react. And so all those emotions that the parent has not dealt with as a child. You got two grown-ups that get married, but it's two children that's trying to maintain the marriage, because you got these little kids inside these grown-up bodies. They got all this trauma and they're bringing it into the marriage, and then what is happening is being transferred off into the children, and then the children start to respond the same way that the parents respond. That's why it's almost impossible to treat a child in any type of therapy environment without treating the whole family.
That's correct. I've seen it. I've witnessed it on my end. I know here in Shreveport, I've been told by other, professional counselors that they are seeing a lot of those kids with ADHD. They saying it's a big number. Larger. I mean, I'm 49. How old are you?
I'm 47.
We're about the same age.
Yes.
I didn't see it as much when I was young, and when I did see it, they've always labeled those children as special education.
Yes.
And I'm hearing now that they're not so-called special education anymore. Now it's ADHD. I know you're telling us the root cause, look at the root cause of things. How do you get a family, like we're talking about, how can we help even the community? When you see a family like that, you may see the mother in the home by herself, you see the children in the home, and they may be experiencing what you state, this trauma, but guess what? They're not coming to see Ms. Bell nor a licensed professional counselor. And that's what we're seeing on the human service side, the ones that are maybe ending up in the juvenile service system, they've never gotten to you.
Right.
They've never gotten to a professional counselor. I know cattle patch school systems, they have something they think they're trying to do. Is there any other suggestion as a nurse practitioner that you probably could give to maybe like a neighbor? I have a neighbor who have children, to be honest with you, that I see it already. Do we just maybe ask them to see a counselor, or do we report them to DCFS?
No, don't don't call the people on. But this is what I would say. Settings like this give exposure to people like me. And so I thank you for this platform, because our community needs to know that there are people in this community that have the expertise and the credentials that look just like them.
That's right.
That is setting the example to say, I'm here. Not only do I have the credentials, but I understand the culture.
Right.
I understand who you are, because I am you and you are me.
Right.
And so because of that, sometimes that takes the wall down to bring up a level of rapport. Exactly. And so a lot of times for parents that are these kids that are dealing with children, and the children are seeing this trauma, before that parent or that mom or dad will seek help, they will come get help for their children. That's the first step. When that child comes in, and that child is being seen, as a child at a certain age cannot come in and be seen without an adult, right? So when that child is being seen, and the counselors are dealing with these kids, even when they're dealing with them one-on-one, I'll bring the family, let them sit in on these sessions. As you're helping those kids, you're going to be helping them.
Right.
And as they see that you're loving and respecting and you're compassionate and you're caring about their children, it'll take a wall down for them. Now you got a way to interact or to step over into. Now we really, our goal is to help this child.
Right.
In order to help this child, I'm bringing in my expertise,
Mm-hmm.
but I need you as a mom or as a dad to help me too.
Mm-hmm.
Can I count on you? Can I rely on you to help me help him?
Right.
What
Right.
mother gonna say no?
Right.
They're gonna say yes. And when they say yes,
Mm-hmm.
that's the opportunity to say the first step to helping him
Mm-hmm.
is allowing us to help you.
That's right. I love it.
Our children learn from us.
Right.
And I'm sitting here as a mother
Mm-hmm.
that raised a child by myself, you know, that have been married, you know, have went through divorces, and I can sit here as the grown 47-year-old woman that I am today that said I finally started to heal that little girl in me.
Right.
Because that little girl in me spilled over into my parenting.
Right.
It spilled over into my marriage. It spilled over into me being a wife.
Yes.
And being, because why? Because who I am in the core is who I am.
Mm-hmm.
And that's what we do. Well, this is just the way that I am. That don't mean that it's right.
That's right.
I had to learn that.
Right.
You know, and I learned that honestly by helping other people.
Mm-hmm.
And as I was serving other people, God was allowing that service to
Mm-hmm.
also heal me.
Right.
And it started
Right.
to change the way I saw things,
Right.
change the way I deal with my daughter, change the way I show up for myself.
Mm-hmm.
You know, and hey, that's where it starts.
It does. Because even concerning on human service side, seeing some of the mothers is what bothered me. I told we talked about this before.
Yes.
Talking about diversity and community environmental factors.
Yes.
I cannot say enough. I think people, I know they're sick of me talking about it, but it's
Keep
everything.
talking.
Yeah, but it's everything you're saying, right?
Right.
That leads to the mental health.
Yes.
And I'm seeing on the human service side so many people, especially single moms, having these adversities. And when I believe, this is what I'm saying on the human service side, if they have the adversity, they may have children, right? The children may slide through, right? But the whole time that child has been traumatized, may never ever get to Miss Bell, to Nurse Rachel Bell. It's the mothers.
Mm-hmm.
That's what's scaring me is I'm trying to figure out, even on the human service side, how to get the mother to know that she herself is being impacted by the adversity. And the adversity has become a social norm. Right? And that social norm then becomes that child's social norms. And the whole time, there may be a lot of trauma.
Yes.
And they never get to Miss Bell.
Right.
And what we're seeing on the human service side is because they never get to Miss Bell,
Mm-hmm.
it tends to end up in the criminal justice system.
Exactly.
Because they never
get it.
And I always said, why can't they have something in the schools? And I keep saying the schools, and they have something, but it may be something there entirely for the family, period.
Mm-hmm.
I know that I'm very upset with what's going on in the administration right now, federal administration,
Right.
and they're changing all these things. But one thing I think they should change is they need to, I'm not sure where it can go, Ms. Bell, but there's something that needs to go in the community somewhere because it's there.
Yeah.
And they just not getting to you. And for us to, we say we want to help our own communities, we want to heal them,
Right.
and they're not getting to Ms. Bell.
Right. And so what my answer to that would be is a simple word: transparency.
Mm-hmm.
It's too many of us that have made it to where I am, where you are, that have platforms that are not being transparent.
Mm-hmm.
Because when I say, if I'm at home and I'm a mother that have went through domestic violence, that have been sexually abused, that have been on drugs, whatever my story may be,
Mm-hmm.
and I'm at home and I'm watching this podcast and you're trying to tell me that I need help, what I see in you is you got it all together. You don't know nothing about me. You don't know my life. You don't know this. You don't know that. But see, it's because we're not transparent. See, a lot of times we get to these platforms and we want to sit all nice and pretty and be all professional and have our
That's
words.
why this is informal.
Right. You want to have your words together
Right.
because I'm about to be in front of the camera. But when you're transparent
Mm-hmm.
and you can look in the camera and say, hey, I was sexually abused too.
That's right.
Hey, I was raped in the military too.
Hey, I was traumatized
Hey,
too.
I was traumatized too.
Mm-hmm.
Now,
Woosah.
it's a different approach because I even experienced this even when I was working as a family nurse practitioner, when I would have people come in and they would have these chips on their shoulders and, you know, they got to add, well, I ain't doing this and da-da-da-da, whatever the case may be. I would always try to stay calm with them.
Mm-hmm.
And there was times that I would just have to put the pen down. I would say, it's a coming to Jesus meeting.
That's
And
right.
slide my chair around and get in their face and say, I've been on welfare too.
Okay.
I've been on, don't let the Louis Vuitton
Right.
fool you.
Right.
Because I ain't ain't always had them. I got out the
Right.
mud too.
Right.
I've been on food stamps.
Right.
You know what I'm saying?
Right.
I know
Been there.
I know about child care assistance because I had to do it.
Right.
I know what it's like to be homeless because I've been there.
Right.
You see what I'm saying? When I do that and I stop trying to pretend like I woke up like this,
That's
and
right.
I've always been like this, now the people in my community can connect with me.
Right.
I don't have to come on your level. I'm going to still be where I am because I worked to get here.
Right.
But I'm not going to tell you that in my working that it was all good.
Mm-hmm.
But what I did was, even in the midst of my trials, my tribulations, my trauma, whatever, I made a decision that I did not want to live like this. I made a decision that I wanted to break the generational curse. I made a decision that I wanted to seek things to be better because I knew there was something better out there. And so that's what I went looking for. So I'm going to teach you how to look for it. Mm-hmm. That's the very reason why, even with my business at It's a Beautiful Mind Consultants, where we're serving those that serve others, and that's anybody. Everybody in this world at some capacity is serving to someone else. And so that's why recently I just graduated, or I'm about to graduate on September the 2nd with a Christian life coach certification. Thank you.
Congratulations.
Thank you. And that was a part of my business that I didn't know I needed. All I knew at the beginning of this year that God was pulling at me like something was more, because even how I'm speaking to you now is exactly how I deal with my clients. And so I was like, God, I know this more than prescriptions. I know this more than medication management. I'm giving these clients all of this extra of me, but I don't know how to formally do this. And just God allowed me to see
no
a
way.
power.
There's no way.
Right.
I don't know there's a way.
Right. I didn't know which way to go.
You had to meet them where they were at.
Exactly.
Identifying with the trauma because you've experienced something.
Exactly. Too. And so being able to do that, and God allowed me to watch a podcast one day, and came across this company called Call Women. It's called Women Institute, and I ended up signing up for it. It's through Natasha Miller. It's a CCI program. Anyway, I did a whole 6-month classes, certification, everything, and in doing that, that was the answer. So now I've added on an entity where we would start in October, while we're doing Christian life coaching, and that is something that I think that I know that God is going to be able to use me to be able to reach women and reach people on the level that you're talking about, because those are one-on-one sessions. There are different packages that you can choose from, but those are one-on-one sessions that we are setting goals. We're looking at obstacles. We're looking at different things that you got going on and where you want to be, and what is the blockage, what is stopping you from getting there, and giving you an action plan on how to reach, how to get to the other side. You know what I'm saying? So I think that once you tap into those types of things, and you tap into what your true calling is, and why you got out. You know what I'm saying? Why you survived the trauma. And this is what I tell people that do sit in front of me that have went through trauma. I was like, but you here. You survived it. There's so many girls and boys that never lived to tell that story. We had to find their bodies and let their bodies talk to us. But you have the ability to talk for yourself. You have an ability to tell your story. So you did not survive your story for you, but you survived your story for somebody else. It is our job in our community that when we come up to a certain level, that it's our job to reach back and pull those other people forward. Teach them, talk to them, be transparent. Don't be embarrassed about where you came from, but give glory to God that you made it through it, and use your platform to give him the glory and the praise. And then you equip other people with those tool belts. You equip other people with those things, because it's enough out here for all of us. I want everybody to win.
Yep. Knowledge is wealth.
It is.
It is wealth. I think that people sometimes take that for granted. You know, they may have the wealth and they don't know they have it because they don't have millions of dollars, and because they're not carrying a Louis Vuitton bag, whatever you stated. They feel like they have no knowledge.
They feel like they have nothing.
Wealthy.
Right.
And my biggest heart, I'm not gonna lie to you, Ms. Bell, is like I said, working on the human service side, seeing the women come to my office, because I get a lot of women, I get a lot of men too, okay? Men too, but the young women, we're so proud. We don't want anyone to know. I wish that I could see, and I'm gonna get it too one day. I don't know how I'm gonna do it, but I'm gonna get somebody like you to help me. In the communities that we go in, because we were going door to door. I told you this before too. In the what they call government housing. You know, I hate the word projects because it sounds like a project, right? I don't like that name. So in government assisted living, we went door to door. I had seen with my two eyes these women at home during the daytime, and you can tell they have some trauma. you can tell there's mental health.
Mm-hmm.
You can see, it's visual.
Mm-hmm.
I don't know. I know back in the 60s, they used to beat the streets, and walk and talk and help each other. I don't know how we can do it today, but I'm going to be honest with you, that's what needs to happen.
Yeah.
The mayor just did that cleanup.
Yeah.
That's the kind of cleanup we need.
Yeah, we need a mental health cleanup.
We need a mental health cleanup. I mean, because mental health is turning into that blight they see. And I will ask you, Ms. Bell, moving to the future, I hope more of you come out like yourself, because they need to see women like you. Yes. Because I think that I talked about it before, not with you, with someone else, is that you were just talking about the classism. They say we made it over here and then they over there.
Right.
We need you, Miss Bell, over here too.
Yes.
Because it's just not enough of Miss Bells. I'd like to know, how does one, woman or man, contact you? How do they do? What do they need to do to get in contact with Miss Bell?
So I'm located on Ninth Street, 2924 Ninth Street. We in Suite 319. Our number is 318-218-5763. Or you can go to itsabeautifulmind.net, and you can go on and look at our website, but you can give us a call today. We are accepting clients. We take private insurance. We take Medicaid, and yeah. So we're here to serve. So yeah.
Anything you'd like to tell the community, Miss Bell? Anything you want to leave them with?
Well, what I want to say is that don't ever be afraid to just take that first step. Just try. We are here. I know that in our community, it is taboo for us to even talk about mental health. It is taboo for us to go to therapy. But I am standing before you as an African American female to say that these are the steps that we need to take so we can have a better tomorrow. And that there are people out here in this community that look just like you, that love you, and that are here to serve you. So please come out. Let us help you.
And you have ones that really care like Miss Bell, you guys. So it's not always about money with everybody. I think a lot of people think that.
Yes.
People really care, and that's why they went into the industry. Thank you, Miss Bell. Thank you so much.
Thank you again.
I look forward to seeing you again.
Yes, ma'am. Thank you.
We're done. They're going to cut it there.
All right.
I love you, Miss Bell. I
love you too.
When I first met you, I bragged on you. I told Lance, I like Miss Bell. That's the one I like.
Thank you.
Because I meet a lot of nurse practitioners, a lot of people, and like I said, a lot of people do lose themselves.
Yeah.
I don't go around saying doctor, and I'm a doctor. But I don't have to do that.
Yeah.
I can do.
Or you have some that's a doctor and you don't say doctor and they quickly correct you.
I'm a doctor. All that stuff. Done it. But it's so much bigger than that now. Even when I went through my dissertation process in the doctoral program, I almost thought it was a hoax at the end.
Right.
I said, this what y'all, are you kidding me? Yeah, this is what y'all said that separated you from me. Although it was a lot of good knowledge. I'm not going to say that.
Right, exactly.
I'm not saying I learned nothing.
Right.
This is what it was.
Yeah, I don't have no desire to even go and get it.
This is what you
Some people ask me all the time, you not going to go get your doctorate?
For what?
No.
This is what it was. That's all I do. I said, okay.
Because it's just a title. It doesn't affect me financially. It creates more debt.
Yes,
is what it did.
And that's what it did.
But it
didn't
give me anything extra.
No.
So I mean, at the end of the day,
you still gotta go get it.
I still gotta go get it.
I still gotta go get it. I'm a black woman with a PhD. That does not mean that I'm gonna walk into somebody's front door and they gonna give me anything.
Exactly. And those are the types of things that I need people to understand. And that's the reason why I stop and I get into their face and I let them know that I have not always been. I am from Tallulah, Louisiana. I grew up with my grandparents. I grew up with a hardworking mother. That when I was younger, I hated it. I was like, I can't stand my mom. But as I got older and God allowed me to see things from a different lens, through the lens of a mother, I had to come back and say, Mom, I'm sorry.
I'm sorry.
I love you. I didn't understand. But that's how most kids are. Yeah. But the thing about it is that, I still grew up in a traumatic environment. My grandfather was a functional alcoholic, amazing man, provider, all of that. But I literally saw my grandmother shoot him. As a little girl, that's traumatic. My family laughs about it now because they say how I got on the phone and was telling my mama, your mama didn't shoot your daddy. Like, I was a little girl.
Right.
But they don't, that's traumatizing. I was molested as a kid. I went into the military, had sexual trauma in the military. I've been through all of that. But the key word is I went through it. And at the end of the day, it is dirty. It is nasty. It is ugly. But guess what? There is not a plant that you see today that has grown into a flower or a major tree that did not go through the dirt. And before we even saw it peeking through the dirt. There was roots. It was already growing while it was covered. So even when you couldn't see me, even in my trauma, even in my darkness, even in my hardest points of life, I was still growing.
Right.
And when I got strength to push up, see, that's all you see is what's on top, but baby, it's
You
the
don't
roots.
see that. You don't see them roots. And that's what people think. They think that they see a beautiful flower.
That's
They
it.
think you don't have no roots. Like
That's right. Oh, that's just a pretty flower. They don't know what I'm going through.
She don't know. She didn't know. She did. She did. No.
I got roots.
I got some dirt.
I got some dirt
came
too.
out some dirt.
And I'm still.
And that's what made me the flower, though.
That's exactly what.
Because some flower was dead.
Come on. Because
you know what I mean?
Because they didn't nurture the
flower
roots.
Was dead.
So you gotta take.
It could be a beautiful flower.
Come on.
Yeah, it may look pretty, but it's dead. It ain't gonna get no new season.
That's right. And see, the thing about it is, even as the flower die, when the flower grows, and you have some that have seasons, some that stay around all year long. You got all these different things or whatever. But in order for it to stay, even in the season it's supposed to stay, I got to nurture the root. And my root is my past.
That's right.
I cannot grow forward and be productive if my roots are not good. I can look like I'm productive because I can spring up in a season, but if my roots are not what they need to be, I won't last during that season. I got to know how to transition in the seasons that I'm in.
I wish they had money to go in that jail.
Well, let me tell you something about the prison system that really bothers me, and I'm just gonna be very transparent. Is that when I get, like, I have somebody just recently came to me after being incarcerated, got incarcerated 15, just got out at 30. Okay, a lot of trauma. Is that they don't care when they have them in jail. Like, this baby wasn't treated properly till he got a messed up walk. We all know why he got that walk. You don't care, but you'll pump all this money into building new prisons to house them based off of their education level in the 3rd grade. But you won't even put money into the mental health to put somebody in the system to help them to really mentally rehabilitate them while they're in there so they can truly be reformed to get out of jail and stay out of jail. Instead, you will let them out because you say they're ready for going back to the community, but you know they're not. You let them out, put them on probation for however many years that you, 9 to 10, you know, a lot of them not going to make it, for them just to come back so you can make more money off of them
per day
again.
in Louisiana.
How much?
70 a day.
That's a lot of money.
It's a lot of money. And I did write a program. It's called Detox. It's new. And we're doing it in the jail now. I've been a jail member for 12 years. Vanessa and I.
It needs to be something in it. It just bothers me that they don't put enough money into that
program. But see, they don't want to put money in.
They don't. And this is when let me tell you this is when I really found out that they did not do. I worked for Northwestern, and I was doing we was getting contracts for our students to be able to go into different environments to do clinical for mental health nurse practitioner. So one of the things, a part of this grant, was getting them into facilities like correctional facilities and different things, so you can see mental illness on different levels as a student. So calling the correctional facilities, the jails that are around here, even the ones down south or whatever. And you know what they tell me? They don't even have a doctor there. They have nurses that just give out the medication, and the doctor comes maybe once a month, and that's it. And I'm going. So my students don't even qualify to go in there because they can only go in there if there's a nurse practitioner that's in that same field that at least been practicing for 2 years, or if there's a doctor.
Oh.
So we can't even contract with y'all because you don't even have what our students need. So my thing is, if my students can't get what they need, even as a student, to be trained, how in the world a patient, even somebody in there with diabetes or high blood pressure, is getting what they need just from an RN passing out? And not even an RN, sometimes it's LPNs. And it's nothing against, hey, I started as a CNA, so it's not even about the title of the RN, just a nurse, period. And all she can do is assess and give out medication. There's no doctor there. There's nobody to treat.
Jail is not for rehabilitation. They say it's not.
And it's not only not rehabilitation, it's not even there for people that's sick. No. People gonna come out worse than when they went in.
Right.